everybody. This is Lisa, owner of Peaches Skincare. You can visit us at peachesskincare.com. This is an introductory to an acne facial or a teenage acne facial that I'm going to show you. Teenagers have always had my heart. In the 3 decades I've been taking care of skin, when I meet a teenager with low self-esteem, they're feeling inadequate, uncomfortable, stressed out, anxiety, you name it, because they're breaking out. And I want to tell you some of the things I've learned over the years that are my holistic approach to teenage acne. This could also work for you if you have adult acne as well. The first thing you need to know is you are not dirty. This has nothing to do with being dirty. This is just something that you're doing to your face or your skin on your face that we need to adjust and figure out what is going on. Hormones are not as big a player as everyone thinks, and nothing bothers me more than when someone comes in and says that they were told it was hormonal. Yes, when a woman has her menstrual cycle, or when you get into your teenage years and you start sweating more, boys start having facial hair. Yes, those things may promote acne, but it's not necessarily your hormones as much as it's the changes in your body. So taking a pill is not always going to fix it. And if you have taken a pill or a hormone for acne, you'll find that once you're done with it or you go off of it, you just start breaking out again. You never really changed how you took care of your skin or the system of the body of the skin. The other thing I hear a lot is, well, my mom and my dad broke out, so I'm going to break out. Again, not true. Now, you may have a different genetic makeup where maybe you have thicker hair or you have darker or lighter skin, so you're more susceptible to the bacteria and fungus that is always on our skin, and it's when we activate it that we have an issue. And so that might be a reason. But just because mom broke out or dad doesn't mean you're going to break out. The other thing that I find really interesting is the harsh medication that people are put on or willing to go on to take care of really not severe but mild acne. And when I say not severe, I mean it's not all over your shoulders and your arms, your chest, down your back, your neck, and your face. When I see someone come in and they've got acne on their face, albeit it can be from a 1 to a 10, and they've told me that they've been put on something as harsh as Accutane, I'm always taken aback, and I ask them, did the physician ask you if you were wearing makeup? Did they ask you what you washed with? And in many cases, the answer is no. Or I'll have a woman come in her 20s and she's got a few blemishes and she tells me she went back on Accutane like she did when she was 16, and it blows my mind. These medications are very harsh to the body. They can affect your reproductive organs. They can affect you over time for many years. So if you don't have to be on medication, we really want to try to do something more holistic. The other thing that I find is wrong, or something that you might be doing incorrectly, is the kind of cleanser you're using. I hear so many people tell me their dermatologist recommended Cetaphil or Neutrogena. Now, they do that because Cetaphil is like a water or a cream cleanser. It really has no value to the skin. Neutrogena has the pH level of stripping a floor of wax, and they give you these products because you're on such harsh medication that they don't want you ripping or tearing at your skin. So we need to look at what you're washing with, change that, and adjust your thinking. The other thing is sunscreen. They tell you to wear sunscreen. When you're already breaking out, we know 9 out of 10 sunscreens are really impure or have a lot of things in it that cause blemishes or cause irritation. Many holistic practitioners, and there are a lot of studies being done that sunscreens get into your bloodstream, like you've heard me say before. But they give you sunscreens because you're on such harsh medications that they're not getting you to clean properly, and you will be very susceptible to a sunburn. So these ideas I'm going to give you today are more holistic, but if you follow them, you're going to see a difference overnight. So the things you want to be aware of, and I'll repeat it when I'm doing the facial. No wet hair when you're going to bed. Pull your hair back. Absolutely, positively no makeup, no cover-up, no cream blush, no tinted moisturizer. Those are all makeups to me. And mom and dad, or if you're living alone, you are going to be a little annoyed at this, but change your pillowcase every day right now while we go through this little challenge of getting rid of your acne. Your diet is also really important. Think about what you're eating. Throw the sodas away. Get rid of the crazy amounts of sugar. And if you're eating dairy, try to not eat dairy during this time. Dairy can create a lot of pustules on your skin. I've seen it time and time again. And when we take you off dairy, we really see a dramatic change. Remember, your skin is the largest organ of the body, the filtration system for the body. So anything you're putting in, if there's not good elements to it, or there's something the skin doesn't like or thinks it's going to harm your body, color, chemicals, many times dairy, it will push it out. And when it pushes it out, it can come out as sweat, dirt, oil, sebum, whiteheads, blackheads, cystic acne. So drink a lot of water. Eat really healthy foods during this time if you can. It doesn't mean you can't have a cookie. It doesn't mean that you can't have a slice of pizza. I don't believe greasy foods break you out. But really cut back on the processed food and the sugar. So I hope you enjoy this acne facial. If you have any questions, please don't hesitate to email me or comment at the bottom of this video, and I'll see you in just a few minutes. Hi, this is part 1 of 2 of a teen acne facial. Essentially, it's the Peaches facial made a little smaller or a little shorter for you to be able to take care of your skin in a little easier way to get started, kind of baby step it. I want you to first alcohol the inside of your nose, like I've showed you in previous videos. You'll just take your alcohol. You can use 2 Q-tips or 1, alcohol each side, and just put it right up inside your nose. This is where bacteria and fungus starts. And so I'd like you to keep that area really clean, especially while we're taking care of acne, but this is something I do every day. I also want you to remember to drink your apple cider vinegar. You can pour some apple cider vinegar in water. You can do it as a little bit of a shot really quickly with some water and follow it with water. Essentially what it's doing is cleaning your gut, keeping your gut clean, the flora in your gut. Everything comes out of your skin and it comes out through your skin and through your face. So alcohol your nose and drink your apple cider vinegar. First, I'm going to wash my face, and we're going to use Restore. Restore is an antibacterial and an antifungal. While you're washing your face, be very detailed. Get into every nook and cranny. Take a minute while you're washing. Don't just pat it around. Really get in there and knead your skin, get all the blood flowing. Clean your eyes, clean your neck, clean your chest and your décolleté, clean your back if you can. Take a few minutes, maybe count to 20 and then rinse. While you're rinsing, also get the blood flowing. Work up on your face or splash your face. Any blood you can get flowing to your skin is only going to help it improve. We washed first, and we're actually going to exfoliate second, only because a lot of times when you have a lot of acne and a lot of oil on your face, I want to get through all that film before we exfoliate your skin. Flawless Exfoliator has a lot of coffee, pomegranate, blueberries, a lot of antioxidants that are going to help you with your skin. I want you to work it around, really wash it around. Take some time. Count to 10 or 20. Work it close to your hairline, all the way down your neck. Don't worry that it's an exfoliant. When you've been told not to use an exfoliant, it's typically because you're on some pretty harsh medication, and because it's so harsh, exfoliants can really irritate your skin. But remember, we're trying to treat your skin in a more holistic manner. Really work it around, and please leave that on for maybe 2 to 3 minutes before you rinse it off. time's sake, I'll move along. And then go ahead and just pat your face dry. Now I'm going to go against everything you've learned about not touching your face. In the mini facial, I showed you to do extractions, and with this, I'm going to do the same thing. The fact is, teenagers are not going to not touch their face. So why not show them how to do it accurately? I get that you don't want to go to school or go out with a giant whitehead. So take tissue, wrap it around both fingers so your fingers are nice and protected and clean. Again, you should have no rings on, no jewelry, no chipped nail polish. And simply push out any whitehead. Only whiteheads that will come out really gently, or a blackhead that will come out gently. The more you mask with your milk of magnesia, which I'm going to show you in a minute, the easier things will push out of your skin and come closer to the surface. So once you've done that, go ahead and take your hydrogen peroxide. This will be your next step. Clean around your skin. It's going to kill any bacteria, any infection. You might even see things get a little white and suds up, or make that white color that hydrogen peroxide does when it gets on a cut. Just means it's cleaning it. Next, take some apple cider vinegar straight from the bottle, or if it's easier for you, spray with apple cider vinegar. Apple cider vinegar straight out of the bottle and the toner will sting a bit. It's not hurting your skin in any way. Okay? After you have done those steps, I want you to take Monistat. So Monistat 7 comes in a box like this. You'll throw everything away but the tubes. It's a myconazole nitrate. It is used for yeast infection, but it is an antifungal, antibacterial. Some doctors even give a form of this in prescription. You do not need that. Just go and get this. Take about the size of a dime. You'll learn what you need, and just put it right on your skin. And then work it up. Work it all over your skin. And after you've done Monistat for maybe 3 days, you can add in Persigel. Persigel is by Clean and Clear. It's a time-released benzoyl peroxide. The thing you need to understand about this is benzoyl peroxide will be the one thing that will irritate your skin. So when you add it in after about 3 days or 4 days, go ahead and just do it on one side of your face so that you can make sure that your skin doesn't have an adverse reaction to it. I can use this every morning and night and have no issues, but people and clients definitely have had issues in the past. Also, be really careful of your eyes or going out into the sun, but the best part about this is that you're all inside right now. After you've done that, you will wait at least 30 minutes. Let those medications absorb, those natural medications, and then you're going to put your milk of magnesia on. For time's sake, I'm just going to put it on my cheek and start to say goodbye to you. Wear this all day, all night. Keep it on your face. Let it be your best friend right now. You'll start to see your acne become clearer. It'll start to go away. You'll start to see it heal. Milk of magnesia is anti-inflammatory. They use it on bed sores, in the hospital, on diaper rash. If you have a pimple that you couldn't get or you felt like you had to push out too harshly, leave it alone. Let the milk of magnesia pull it forward. So milk of magnesia will be your last step. You'll leave it on after cleaning your skin properly each day. I would recommend, if you're a teenager, to wash at least 2 times a day, if not 3. And once you get back into school, once you get back into life, doing it in the middle of the day is a really great idea. I hope you'll tune in for the second part. If you have any questions, don't hesitate to comment, and I will look forward to seeing you.